Hey there, viewers! When you hear the word lips, what comes to mind? I'm sure it must be either kissing or smiling, but your lips play a much more important role in your body. They say the eyes don't lie, apparently your lips don't either. Lips work as a mirror of your body, signaling serious health problems. You can tell a lot about your health just from the appearance of your lips. Today we are talking about all the signs to look for in your lips that may point to health problems. Ranging from dry lips, to cracked lips, to chapped lips, each one points to a different health condition. Stay tuned! Number 1. Twitching lips. Lip twitching is normally harmless, but it could also be a sign of an underlying condition. It's the result of miscommunication between your lip nerve and the muscles it controls. It can be a sign that you may be suffering from fatigue, stress, weak nervous system, fear, self-doubt, and emotional tension. Twitching lips can be a sign of you ingesting too much caffeine. They can also signal a potassium deficiency as well as reactions to certain medications or drugs. To take care of the problem, try cutting out your caffeine and alcohol intake, reducing stress, and eating potassium-rich foods. Number 2. Swollen lips. Did you try a new lipstick? Eat something you probably shouldn't have? If you notice that your lips get bigger every time you try different foods or cosmetics, you may be suffering from an allergic reaction. Allergic reactions that come from food you've eaten are usually accompanied by watery eyes, itchy skin, or hives. If your lips start to tingle and puff up, stop what you're doing and assess the situation. You could be having a serious reaction to something you've eaten or come in contact with. Swollen lips can also be a result of getting hit in the mouth. Needless to say, if your lips start looking like Daffy Ducks, try consulting a doctor. Number 3. Changed color of lips. Healthy lips tend to be rosy pink or light red. You'll know this because your blood vessels are visible underneath the skin covering them. Any change in color or discoloration may point out to an underlying problem. If your lips take on a bluish or purple tint from time to time, it could mean that you are extremely cold. There are also insufficient levels of oxygen in your blood, known as cyanosis. This could indicate heart or lung problems. If you see your lips turning brown with spots throughout, it may be a sign that you have some form of skin cancer and should see a dermatologist immediately. If your lips turn unnaturally pale pink, white, or even gray, this indicates that you have anemia or low iron levels in your blood. You may notice bright red lips if you are suffering from an allergic reaction. This can also be the case if you have been out in the sun. Just like every other part of your body, your lips can get sunburned. Always select a lip balm that offers sun protection. Number 4. Chapped lips. Chapped lips can mean that your body is responding to its need for hydration. Contrary to popular belief, licking your chapped lips won't get the job done. In fact, it makes your lips even more crusty and dry. If you would like to erase them, drink plenty of water. Chapped lips also means that you've been overexposed to wind, sun, or dry air. To remedy this issue, you may want to give exfoliating and moisturizing a try. Take some sugar and rub it on your lips. This will start the process of exfoliation. Be sure to apply a thick lip balm on your pucker-uppers afterwards. Number 5. Growth on lips. Growths can be a cause of concern on any part of your body, and lips are no exception. Any growth on your lips could be a sign of lip cancer. Other signs of lip cancer include dry, white patches, stubborn sores that won't heal, painful lips, and numbness. If you notice any such growth, see a doctor immediately. Always try using a lip balm with SPF built in to prevent lip cancer. Number 6. Lips cracked at the corners. You may have developed cracks in the corners of your lips, which is fairly common during summers and winters. One of the most common causes of these cracks is angular cheilitis, a condition signified by pain sores at the corner and sometimes inside your mouth. This condition happens either due to poor diet, lack of vitamins, or a fungal infection. It can be treated easily with an antifungal cream or by following a healthy and balanced diet. Cracks at the corners of your mouth may also be a sign of diabetes. This is because a yeast-like infection can develop due to high levels of blood glucose, which affects your mouth's delicate edges. You can also develop these cracks due to yeast infection from buildup of bacteria. This can be due to wearing a retainer or drooling in your sleep. Number 7. Cold sores on lips. Cold sores are small blisters that appear around your mouth on the edge of the lips. They are usually the result of the herpes virus, and once you have it, they can appear anytime if you're exposed to stress, fever, and exposure to sunlight. More than half of the United States has the virus, despite not showing any signs or outbreaks. But don't worry, they are pretty easy to cure. You can put on a prescribed medication to suppress the cold sore and always wear sunscreen. They will generally clear out within 10 to 12 days. Number 8. Sensitivity and tenderness of lips. If you have very sensitive and tender lips, they would often be accompanied by other symptoms such as cold sores or swelling, providing a good indication of what the underlying issue may be. If your lips feel sensitive to touch without other problems, it may be a mild allergic reaction or sensitivity to something topical. Tenderness in the lips may be caused by lipsticks, glosses, or balms. Toothpaste may also be a trigger. Number 9. Burning lips. Having a burning sensation in your lips after having spicy food is pretty normal. But if you are experiencing a burning sensation even without having eaten any super spicy foods, it could be a sign of an underlying medical issue. Burning pain in the lips is usually associated with vitamin B12 deficiency. However, research also suggests that a burning sensation in the lips may be caused by malfunctioning nerves in your head and neck. This is why it is commonly seen in people who suffer from depression, anxiety, or some other psychological disorders. Number 10. Red ring around your lips. A red ring, also known as a red aura around your lips, can signal a number of different conditions, the most common of which is called the lip licker's dermatitis. The cause of this irritation of the skin is quite self-explanatory. Repetitive licking of lips allows saliva to dry out natural oils around your lips, making them red and itchy. Its treatment is pretty simple. You have to kick the habit of licking your lips and re-moisturize the affected areas. The red ring around your lips could be caused by an allergic reaction to certain foods, like wheat, dairy, soy, or soda, in which case, the most effective treatment would be changing up your diet and staying away from such foods. Number 11. Tingling sensation in your lips. Tingling sensation in your lips may result due to a couple of factors such as stress or exposure to cold temperatures. However, it can also be a sign of a stroke or transient ischemic attack, TIA. A TIA occurs when normal blood flow in your body gets obstructed, starving the brain of oxygen. TIAs are called mini-strokes and last only a few minutes without causing lasting damage, but experiencing a TIA very likely means a full-blown stroke is on the way. There are also cases where food poisoning may cause tingling. It can develop soon after eating contaminated foods. Number 12. Bumps on your lips. Lip bumps come in different sizes, appearances, and with various symptoms ranging from red bumps to small blisters that are hardly noticeable. An allergic reaction may cause inflammation of the lips followed by a bump, which normally disappears on its own after a while. In rare cases, lip bumps can be a symptom of a cancerous tumor developing in your mouth, which begins as a small sore or bump appearing on the lips that will not only heal, but will continue to grow and spread to the inside of your mouth. Do your lips display any of these problems? Let us know in the comments below. We'd love to hear from you.
Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait, what kind of bestie would we be if we don't tell you about our other awesome videos? Go ahead, choose the left or right video and enjoy.